In 2017, over 800 million people suffered from chronic kidney disease globally. The disease burden is especially high in low and middle-income countries where many individuals struggle to access treatment. For those in need, kidney replacement therapy is a lifeline. This includes peritoneal dialysis, hemodialysis, and kidney transplants, but providing access to these treatments is complex. Kidney replacement therapy is very costly and often requires long-term support for patients. Investments in infrastructure, training, and retaining healthcare professionals take both time and significant resources. These complexities have left many countries, especially low and middle-income countries, struggling to incorporate kidney replacement therapy, especially dialysis, into their universal health programs.
The biggest hurdle is to develop a policy of delivering kidney replacement therapy which is sustainable, which is scalable, and which is affordable for the healthcare system. It delivers appropriate outcomes and is accepted by the society and also by the healthcare systems.
The path forward may be complex, but through collaboration, investment, and innovation, we can ensure that this life-saving treatment reaches those in need. After 15 years of implementing a peritoneal dialysis policy that increased access to care and reduced financial burden, in 2022, Thailand pivoted its kidney replacement therapy policy, enables greater flexibility in choosing dialysis modality for their first-line treatment. We have embarked on an initiative that brings together national and international stakeholders consisting of policymakers, professional associations, researchers, and patient groups to reflect on the evolving landscape of kidney care and explore future directions for sustainable, long-term solutions. Through this initiative, we not only seek to draw lessons for Thailand, but also share these with countries that share the same goal of ensuring sustainable access to kidney replacement therapy for all.
การสำรวจตัวเองแปลว่าเราต้องรู้จักจุดอ่อนของตัวเองการรู้จักตัวเองคือต้องยอมรับเปิดกุญแจว่าเราอาจจะมีข้อบกพร่องแล้วเฟซกับมันหรือเปล่าเพราะฉะนั้นตรงนี้มาถึงจุดนี้เนี่ยหากว่าจะถอดบทเรียนจริงๆมันจะต้องเป็นอะไรที่เผยแพร่ได้ publish ได้
Because eventually our goal is to provide outcomes to the patients which are as optimal as possible in line with their preferences, the values and preferences of the society, and of course keep the overall cost low as possible.